also like to have the opportunity to talk about United Way of New York State's request for state funding to ensure that all 6 Region 211 centers are providing services 24/7, 365 days a year. As you know well, United Way's 211 offers health and human services, information, referral, assessment services, and crisis support. We do mental health crisis for Putnam County. And we assist people for everyday challenges of living, as well as development times during disaster, and we work very closely with the American Red Cross and other community emergencies. 211 is confidential, comprehensive services that enables government and nonprofit agencies to realize concrete cost savings, as well as increase customer service to residents throughout our region. Our call center, you can call for any phone, any type of phone, and you will reach a call center located in White Plains to speak with professional, trained, paid call specialists from 8 a.m. to 8 p.m., 7 days a week, 365 days a year. We offer 150 different languages, and we have bilingual staff speaking Spanish at all times. All of the 211 call centers and database throughout New York State are regulated by a national organization which certifies the parameters to be used, as well as provides training for all call specialists. For a myriad of toll-free numbers, actually, let me just switch a second. Go ahead. Okay. We have been told. Well, 1 minute. I've done this first. See, I think I have the wrong one. In addition, a strong network. All right, totally confused here. What did I do? Sorry. Here we go. In 2010, the Hudson Valley 211 call center was available to more than 5.3 million people in the Hudson Valley, the Adirondacks, North Country, and Long Island. It was the first launched in September 2005 and was able to assist after the aftermath of Hurricane Katrina for residents in the Hudson Valley who wanted to help. It is now part of a network of regional 211 call centers in New York State. United Way of Westchester and Putnam serves as the lead agent for our fiscal 211. More than 170 calls and more than 190 services referrals have been made. In addition, more than 600 website searches, which is www.hudson211.org, has been completed. As you can see from the map that I provided, and I can leave some copies for you, these serve. 211 is accessible to 93% of the state's population, and any regional call center can easily cover the remaining population. 211 is a public-private partnership. Fundings come from grants from the local United Ways, and it serves as well as a corporate foundation, grant contracts with local and state governmental entities. In addition to providing its core service of comprehensive information referral services and real-time, up-to-date database, the Hudson Valley does a variety of different contracts that we work with different counties and other nonprofits. What 211 needs now? From 2006 to 2008, 211 throughout the state received a total of $13 million to create a network of call centers that would allow New York State citizens to access information referral 24 hours a day, 7 days a week, 365 days a year. Since 2008, we've been working with various legislators and state agencies to seek additional funding, as the money has already been utilized and we need annual funding to pay for technology and personnel costs, or more and more people are utilizing our services. We totally understand how difficult it has been to ask for new funding. Therefore, we're not asking today for new funding. Instead, we're asking for the state to fund 211, re-examining the costs that the state is already paying for a myriad of toll-free helplines. Consolidation of those helplines would easily pay for the $3.8 million that United States and New York State needs to fund 211 through the state this year. We have asked by the Comptroller Office and the FCC that there are more than 350 toll-free hotlines, or 800 numbers, with just a few of them required, as example, child abuse and abandoned infant hotlines. Most states, human services agencies, some of the kind of the outreach of functions or mandates to help people find and receive benefits. Governor Patterson proposed consolidation of these toll-free numbers. in January 2009, but nothing actually has happened. In fact, even more helplines were created in 2009 and 2010. Some of these helplines are located outside, such as Maryland, and out of the country. For H191 N1 was answered by Nova Scotia. We are not privy to the total cost of these helplines. However, the Comptroller's Office estimated that the cost of simply paying for the toll-free number itself is approximately $9 million. A state agency have also continued to spend more money to build duplicative, specialized databases to address a single issue without instituting a plan to update the information or to link them to other related services. Finally, for each number that is created, the state has to pay for marketing so that someone knows how to reach these numbers. I'm here today to ask you to support the funding of 211 across New York as a way that the state could save money and serve the public in the most efficient, effective manner by consolidating its all toll-free information referral numbers and by utilizing 211. Consolidation would immediately save millions of dollars, some of which could pay for the 211 services, so I'm not asking for new funding. If the state funded 211, callers and database searches would get the information to help they need with just one easy number to remember and one click to a database. In addition, 211 network would relieve the surge of what we spoke about, and American Red Cross said, emergency calls to 911 during an emergency or disaster. An example of that in Orange County when we had the winter storm, there were 250 calls that were coming into the Newburgh 911 center and their OEM. Okay, so as I say, we're not asking for new dollars. We're asking just to reallocate the dollars that are going to 800 numbers, and we could be able to handle it across New York State by 211. Thank you.
Thank you.